Ladies and gentlemen, let me ask you a serious question. When was the last time you listened to your body, really listened, because your body has a voice, and when it's whispering, you'd better not wait until it starts screaming. Now, I'm not here to scare you, I'm here to wake you up, because there are 5 warning signs your body gives you, and if you're smart, if you're responsible, if you value your life, you'll pay attention when they show up. Pain is one of the most misunderstood messages the human body sends. Most people treat it like an inconvenience, like background noise they've learned to ignore. But pain is not an inconvenience. Pain is information. Pain is intelligence. Pain is your body's built-in emergency alert system, and when you feel it, especially when it stays longer than it should, it's trying to tell you something important. Now, here's the truth most people don't want to face. If you've been living with recurring or persistent pain, that is not normal. That's not just aging, and it's not something you're supposed to get used to. There is no award for being the toughest person in the room when your body is begging for attention. You don't get a medal for pushing through symptoms. You just get worse symptoms, because when your body speaks and you ignore it, it doesn't stop talking. It starts yelling. Let's take headaches, for example. Everyone gets them occasionally, but if you're dealing with frequent, pounding headaches that disrupt your work, your focus, or your sleep, you don't just need pain relief, you need answers. That could be blood pressure, that could be dehydration, that could be nerve compression, hormonal imbalances, or something even more serious, and brushing it off with a pill or a nap isn't treating the problem. It's covering it up. It's like taping over a flashing warning light on your dashboard and pretending everything's fine while the engine is overheating. Same thing goes for back pain. Too many people live with chronic back or neck pain as if it's just a fact of life. They tell themselves it's from sitting too long, or sleeping wrong, or lifting something heavy that one time 5 years ago. But pain that stays for weeks, months, even years, that's not soreness, that's dysfunction. And dysfunction left untreated doesn't improve with time. It compounds, muscles get weaker, nerves get more irritated, joints wear down, and before you know it, what started as a nagging ache becomes a debilitating condition. Let me be clear about something. Pain is not the problem. Pain is the signal that there is a problem. When your ankle hurts every time you walk, or your shoulder aches every time you lift your arm, your body is showing you exactly where the problem is. And every time you silence that message without dealing with the cause, you're not solving anything. You're delaying healing, you're prolonging suffering, and in some cases, you're risking permanent damage. And don't fall for the lie that it's just stress. Yes, stress is real. Yes, it affects your body. But let's not use it as a blanket excuse for every unexplained pain. If you're waking up every day with chest tightness or stomach cramps or tension in your jaw that makes it hard to eat or speak, don't just chalk it up to anxiety and move on. Stress may contribute, but it doesn't cancel out your responsibility to investigate. Because when your body cries out over and over again and you don't listen, that's not strength. That's negligence. We live in a culture that praises grind, hustle, and toughness. But let me tell you something. Real toughness is wisdom. Real toughness is knowing when to push through and when to pause. There's no glory in ignoring the signals that could save your life. There's no honor in dragging a broken body through life when the help you need is one decision away. And make no mistake, your body wants to heal. It is built for restoration, but it can't heal what you refuse to acknowledge. Pain that doesn't go away is a plea. It's your body waving the flag saying, please look here, something needs your attention, something's out of alignment, something's not right. Whether it's musculoskeletal, neurological, internal, or systemic, persistent pain is always worth checking out. So don't minimize it, don't normalize it, don't rationalize it, and for the love of everything you want to accomplish in this life, don't ignore it. The sooner you investigate that pain, the sooner you can reclaim your strength, your energy, and your freedom. There's something your scale might be trying to tell you, something way more important than how your clothes fit or how you look in the mirror. Sudden changes in weight, whether gaining or losing, are one of the clearest signs that something inside your body is out of balance, but most people either ignore it, blame it on age or diet, or worse, they celebrate it without asking why it's happening. Now let's be clear, if you've changed your eating habits, started a workout program, and you're seeing weight drop as a result of consistent effort, that's great, that's controlled, that's expected. But if the pounds are falling off and you haven't changed a thing, that's not a miracle. That's a mystery, and it needs an answer. Unexplained weight loss is not just a lucky break. It's a possible indicator of something much deeper going on. Could be your thyroid, could be your blood sugar, could be your digestive system not absorbing nutrients, could be muscle wasting. In some cases, it could even be a sign of cancer or autoimmune disease. So when your body suddenly starts shedding weight without your permission, don't high-five the mirror. Call a doctor, ask questions, because losing weight when you're not trying is not fitness. It's a flag, and the flip side is just as important. If you're gaining weight and you know your habits haven't changed, if your eating and activity levels are consistent but the number on the scale keeps climbing, that's your body waving at you, trying to get your attention. Maybe your hormones are out of whack. Maybe your metabolism has slowed down due to a deeper issue. Maybe your insulin levels are creeping up. Maybe inflammation is out of control. Maybe you're dealing with chronic stress that's throwing your entire endocrine system into chaos. Let's get something straight. Your body does not betray you. It responds to inputs. It reflects internal reality. It doesn't gain or lose significant weight randomly or by accident. Every pound gained or lost carries information. It tells a story, and the longer you ignore that story, the harder it becomes to get back in control of your health. Too many people treat weight changes like a cosmetic issue. They think it's just about how they look in photos or how their jeans fit. But weight is more than that. Weight is a vital sign. It's a visible marker of invisible processes happening inside of you. And when those processes get disrupted, weight is often one of the first signals to show up. Your body doesn't wait until the organs fail to show symptoms. It starts nudging you early. It whispers before it screams, but you've got to be willing to listen. And let's talk about emotional responses. Because a lot of people tie their self-worth to their weight, so when it changes unexpectedly, they either panic, obsess, or deny it altogether. That's not health. That's shame disguised as control, and shame never leads to healing. What leads to healing is ownership. What leads to healing is curiosity. What leads to healing is asking the hard questions and being honest about the answers. This is not about aesthetics. This is about your life. Sudden changes in weight are often the body's way of saying, hey, something's going on here, and it's bigger than you think. That change could be linked to diabetes, liver function, kidney issues, hormone imbalances, digestive diseases, infections, or even depression. The causes are wide-ranging, but the action step is the same: investigate, and don't make the mistake of waiting until the number becomes concerning. You don't wait until a bridge collapses to check its cracks. You inspect early, you act early, you protect early. If your body is gaining or losing weight rapidly without a clear reason, that is a sign, that is your cue, that is your warning light. And you have a choice. You can either keep hoping it'll fix itself, or you can take the wheel and drive yourself to someone who can help you find out what's really going on. The biggest lie we've been sold is that our weight is only about food and exercise. That's only part of the equation. Your body is a complex, interconnected system. When your liver isn't working right, you'll gain weight. When your thyroid is overactive or underactive, you'll see changes in your weight. When your gut is inflamed, or your pancreas is failing, or your cortisol is off the charts, you're going to see that reflected in your body's composition, often before any other symptoms show up. So don't dismiss it. Don't explain it away. Don't wait it out. Investigate it. Sudden weight change is not the problem. It's the symptom, and symptoms are your chance to step in before something more serious takes root. Your body isn't trying to frustrate you. It's trying to protect you, but you've got to stop treating these changes like cosmetic inconveniences and start treating them like the medical messages they are. There's a certain kind of tired that sleep won't fix. You know exactly what I'm talking about, that bone deep exhaustion that doesn't lift even after a full night's rest, that shortness of breath that hits you after climbing just one flight of stairs or walking across a parking lot or doing something that never used to leave you winded. You feel like your energy has been hijacked and you start to believe that this is just the new normal, but let me tell you something, it's not. Shortness of breath is one of the most underestimated warning signs your body can send. Most people brush it off. They blame it on being out of shape, getting older, or just having a long day. But when you're gasping for air more than you used to, when you find yourself needing to sit down and catch your breath after light activity, your body isn't being lazy. It's waving a red flag. It's saying, hey, something's not working right here, and you'd better listen before that flag turns into a siren. You see, breathing isn't optional. Your lungs, your heart, your blood, everything depends on oxygen. And when something starts interfering with your ability to take in that oxygen efficiently, your body responds immediately. You just don't always recognize it for what it is. That breathlessness could be a sign of heart disease. It could be early signs of congestive heart failure, pulmonary hypertension, or even a silent arrhythmia. It might be your lungs telling you that asthma, COPD, or even a hidden infection is at work. It could be fluid buildup. It could be low red blood cell count, and sometimes it's all happening at once, and then there's the fatigue, not the kind where you stayed up late watching TV or had a long week at work. I'm talking about the kind of fatigue that makes you feel like you're moving through wet concrete, the kind where you wake up tired, where you do the bare minimum and feel completely drained, where even small decisions feel overwhelming and you start skipping things you love because you just don't have the energy anymore. That's not laziness. That's not a lack of motivation. That's a clue, and your job is to follow it. When your body is struggling, it starts reallocating its resources. It pulls energy away from non-essential systems and focuses on survival. That means your immune system might start to weaken, your muscles lose strength, your brain fogs up, you can't focus, you start canceling plans, you find yourself less patient, more irritable, more forgetful. You're not falling apart, you're running on empty, and it's not your fault. But it is your responsibility to find out why. Fatigue and breathlessness are often tied together, and here's the truth, they're often symptoms of the same root issue. If your heart isn't pumping effectively, your body isn't getting the oxygen it needs. If your lungs are compromised, you're not getting enough air in. If your blood is low on iron or has abnormal cells, it can't carry oxygen efficiently. And when your cells are starving for oxygen, they start shutting down functions. That's why you feel tired. That's why you can't focus. That's why even getting out of bed feels like lifting a mountain. Most people treat these symptoms like annoyances. They assume they just need more coffee, more rest, or a weekend to recharge. But if you're constantly hitting a wall, if your energy is unpredictable, or if you feel like you're losing momentum for no reason, that's not a lifestyle issue. That's a medical issue, and no amount of caffeine or power naps is going to fix what your body is trying to warn you about. Now, this isn't about being alarmist. This is about being aware. Because the earlier you take these symptoms seriously, the faster you can get to the root. And let me tell you something powerful. Fatigue and breathlessness are never random. Your body is too intelligent for that. It knows what it's doing, but if you don't listen, if you ignore the early signs, you might not get a second warning. Because some of the most serious conditions show up silently, slowly, subtly, and when you wait too long, subtle turns into severe. Mild turns into chronic, and temporary turns into permanent. If your body feels like it's slowing down for no reason, if you're breathing harder during activities that never used to challenge you, if your energy is inconsistent and your strength is fading, don't you dare call that normal. Don't you dare accept that as part of life, because this isn't about slowing down, it's about waking up. Your energy is your power, your breath is your fuel, and when they start slipping away, that's your sign to take action, before your body forces you to. There are certain signs the body gives you that should never, under any circumstances, be ignored. And unusual bleeding is one of them. Blood is supposed to be in specific places, your veins, your arteries, your capillaries. It's not supposed to show up in your urine. It's not supposed to be in your stool. It's not supposed to drip from your nose without cause or appear on your gums every time you brush your teeth. When it does, that's not a coincidence. That's not a one-off. That's not something to watch and wait. That is your body sounding an alarm. Most people are conditioned to shrug it off. They see blood in the toilet and tell themselves it's probably something minor. Maybe they lifted something heavy. Maybe they ate something spicy. Maybe it's just hemorrhoids or a cracked lip or dry air. But you don't get to play the maybe a game when your body is showing visible physical signs that something is off. Blood outside its normal boundaries is never normal. It's not something to panic over, but it is something to investigate immediately. Your body doesn't let go of blood without a reason. That could be a tear, a rupture, an ulcer, a clotting disorder, or something deeper like gastrointestinal disease, kidney problems, or even cancer. When you see blood where it doesn't belong, you're not just looking at a symptom, you're looking at a story. And the longer you delay reading that story, the more chapters you miss, and those missed chapters can cost you. Let's talk about the blood you can't explain, a nosebleed that happens out of nowhere. Blood on the pillow from your gums when you wake up. Blood in your spit after a cough. These aren't random, these are patterns, and if they're new to you, they need to be respected. They could be signs of a bleeding disorder. They could be signals that your platelet levels are dangerously low. They could be related to liver issues, infections, or vascular damage. And in some cases, they're tied to high blood pressure that's been silently building for years. It's not about fear, it's about being informed. And what about bruising? Random bruises that show up and you don't remember bumping into anything. Bruises that take longer to fade than they used to. That kind of discoloration isn't just about fragile skin or age. It's about your blood vessels and your blood itself. It could point to clotting issues, anemia, or something happening with your immune system. And when it becomes a pattern, that's not cosmetic, it's clinical. You don't have to be a doctor to know when something looks and feels wrong. You just have to stop ignoring it. And then there's one of the most overlooked signs of all, the color of your stool or urine. People don't want to look. They don't want to talk about it. But guess what? Your body talks in patterns, and what comes out of your body tells you a whole lot about what's happening inside of it. Dark, tarry stool can be a sign of bleeding in your upper GI tract. Bright red blood could be coming from your colon or rectum. Blood in the urine can mean anything from a kidney stone to a urinary tract infection to more serious conditions like bladder or kidney cancer. That's not something you wait to see if it gets better. That's something you address before it gets worse. But we've been conditioned to downplay it all. We're told to toughen up. We're told not to make a big deal out of it. We're told to save the doctor visits for emergencies, but here's the problem with that mindset. By the time something becomes an emergency, you've already missed your window to act early. You've already let what could have been prevented become something that has to be managed, sometimes for life. There is no strength in denial. There is no wisdom in delay. You don't get bonus points for pretending you're okay when your body is clearly telling you you're not. When you see bleeding that doesn't make sense or discoloration that looks out of the ordinary, your job is not to panic, but it is to respond, it is to investigate, it is to step up, take ownership, and give your body the respect it deserves by getting real answers. Because bleeding is not just a symptom, it's a message, and every message your body sends is an opportunity to catch something early, an opportunity to prevent something serious, an opportunity to step into health instead of falling into crisis. But only if you're willing to stop brushing it off and start paying attention to what's right in front of you. Absolutely. Here's the 700-word expanded version of the fifth sign: changes in mental clarity or mood, continuing with the same bold, persuasive tone and without headings or a conclusion. There's a dangerous myth floating around that as life gets busier, more stressful, and more complex, it's normal to feel scattered, foggy, forgetful, or emotionally volatile. That being mentally drained is just part of being an adult. That losing focus, misplacing your thoughts, or riding emotional highs and lows without explanation is just part of the grind. Let me tell you right now, that is a lie. When your mind starts working differently, slower, heavier, more confused, more irritable, your body is not failing, it's signaling. Mental fog is not a personality flaw. It's not laziness, it's not a motivational issue, it's a symptom. Your brain is the most energy demanding organ in your body, and when something in your system is off, hormonally, neurologically, metabolically, your mental sharpness is one of the first things to take the hit. You start losing words, you forget what you were doing, you reread the same sentence 5 times and still don't absorb it. You stare at the wall, not even tired, just blank. You're not off, you're out of alignment. Mood swings work the same way. When your emotional state starts shifting rapidly for no clear reason, when you go from fine to furious, from upbeat to hopeless, from motivated to numb in a matter of hours, don't just blame it on stress. That's too easy. That's what people say when they don't want to dig deeper. But your mood is governed by chemistry, and when your hormones, your neurotransmitters, or your nervous system gets disrupted, it shows up in how you feel. It shows up in how you think. It shows up in how you relate to people. That's not weakness. That's biology. People say things like, I'm just tired, or I've got a lot going on, and sure, that might be true for a day or two. But when the fog doesn't lift, when the tired becomes chronic, when your patience wears thinner than usual, when your reactions feel foreign even to yourself, that's not something you brush off. That's something you pay attention to. Because changes in mental clarity or mood are often the first signs of deeper problems, and if you ignore the mental and emotional indicators, you miss the early warnings of physical imbalances. Let's talk about your brain's relationship with your body. You are not a mind on one side and a body on the other. You are one system, one network. When your thyroid is underactive, you might feel depressed or sluggish. When your blood sugar crashes, you might get anxious or irritable. When your gut is inflamed, your brain gets foggy. Because gut health impacts neurotransmitter production like serotonin and dopamine. When your adrenal system is burned out, your motivation evaporates. You lose drive not because you don't care, but because your biology won't let you push forward, and here's where it gets dangerous. When people normalize it, when people say, this is just who I am now, they start adapting to dysfunction. They build routines around a foggy brain, they accept a shorter fuse, they adjust their goals downward to match their low energy and call it maturity, but that's not growth, that's slow decline. You don't want to learn how to function in dysfunction. You want to fix the root and restore the clarity and energy that's your natural state. Mental changes are not always caused by trauma or stress. Sometimes they're driven by iron deficiency, or B12 deficiency, or inflammation, or autoimmune activity, or early neurological changes, or chronic infections. There are dozens of physical causes that can express themselves mentally and emotionally, and the only way you find them is by refusing to accept mental fog or mood swings as just part of life. How many people are walking around being medicated for depression or anxiety when the real issue is a dysfunctional thyroid or a gut that's leaking toxins into the bloodstream? How many are being told to think more positively when their brain is being starved of critical nutrients? How many are trying to tough it out when what they really need is a proper diagnosis? You can't discipline a biological imbalance. You can't set your way out of a vitamin deficiency. You don't fix internal chemistry by pretending it's all in your head. When your mind feels like it's slipping, when your memory fades, your reactions feel off, your joy disappears, and your fuse shortens, it's not just stress, it's not just aging, it's a call to investigate. And ignoring it doesn't make you strong, it makes you vulnerable to something deeper and harder to reverse. You don't wait until you crash to acknowledge the warning signs. You take action when the signs first appear, while there's still time to correct the course and reclaim the sharp, steady, grounded mind that's been buried underneath the symptoms.